Hi friends, myself Dr. Nitesh Patel, diabetologist from Samarpan Hospital, Akbar Nagar, Ahmedabad. Uh, Today we will talk something about hypertension. We have various headings for hypertension. Let us see understand this hypertension according to various headings. Just like we have a question in our mind that what is hypertension? Hypertension, the word itself says hyper is high and tension is pressure. High pressure in your blood vessels and your heart. That is hypertension. Now, second question comes in our mind that what is how can you diagnose this hypertension? That hypertension is diagnosed. First and foremost thing I would like to tell you that hypertension is a silent disease. That many a times, almost more than 60% of patients of hypertension are asymptomatic. Sir, I don't have any chest pain, or I'm not feeling any dizziness, or I don't have any symptoms of hypertension like headache or dyspnea or like so. But I would like to tell you that 60% of hypertensive patients in initial stages are asymptomatic, but on a long run, after a period of 7 to 8 years or a decade, if you are hypertensive and you are not taking any medication for your blood pressure, then you are likely at a risk of stroke, that is effect of paralysis, or at a risk of heart attack or kidney failure, and many more complications. So if you are having hypertension, just diagnose it and treat it. So now question comes in our mind that how will you diagnose our hypertension? Hypertension is diagnosed by a simple instrument that your doctor uses, sphygmomanometer, and from sphygmomanometer he will diagnose your blood pressure. And what is the cutoff point for hypertension? Ideally, what we can say, the normal on an average blood pressure is 120 systolic and 80 of a diastolic. These are normal. Below 120 and below 80 systolic and diastolic blood pressure respectively are normal blood pressure. But if your blood pressure systolic of more than 140 and systolic and more than or equal to 90 diastolic, then you are hypertensive. So the question comes in our mind that 120 and 80 are normal pressure and 140 90 are hypertension. Then between 120 to 140 of systolic and 80 and 90 of diastolic, they are borderline risk for development of hypertension. Those they are pre-hypertensive patients, and they also have to regular monitor their blood pressure. And if they have blood pressure regular blood pressure high blood pressure routinely in regular checkup, then they also have to consider diet and lifestyle modification for 3 months. And even after 3 months of this diet and lifestyle modification, your blood pressure remains borderline high or high, then you have to take your treatment. So this is something about diagnosis of hypertension, that more than or equal to 140 systolic and more than or equal to 90 diastolic, that is hypertension. Now question comes in our mind that sir, am I hypertensive, or मुझे hypertension हो सकता है? Can hypertension can occur to me? The question arises, and the answer is those who are at risk. Who are at risk? Those who are having aged more than 45 years of age. Male patients are prone to develop hypertension. Those who have positive family history, those who have history of hypertension in their families, in father, mother, they are at risk of hypertension. Those who are obese, whose weight is higher than height, those who have body mass index more than or equal to 23 in our Asian Indian people, they are at risk for development of hypertension. And those who are diabetic, they are also at risk of hypertension. So to conclude, diabetic patient, positive family history, age more than 45, sedentary lifestyle, obesity, these are a risk factor for development of hypertension. Now question comes in our mind, if suppose I will not take any medication, sir, I'm not symptomatic, I will not take any treatment, so what happens to me? Right now, for immediate period of time, if your blood pressure is on borderline high, like 150 or 149 or 160 or so, and diastolic between 90 to 100, immediately you will not having any symptoms. But on a long period of time, your heart wall may get thickened and it will end up with diastolic heart failure, as well as you are at a risk of brain stroke and kidney failure. So friends, please keep in your mind and try to control your blood pressure below 140, below 120 and 80. So when to treat our hypertension? Again, try to achieve your blood pressure below 130 of systolic and 85 or 80 of diastolic. If you are diabetic, then definitely you have to take extra care for controlling your blood pressure, and try to consult your doctor to keep your blood pressure systolic of 120 and diastolic below 75. So, what are the basic remedies to control blood pressure other than medication? That is again one another question comes in our mind. That apart from medication, you can do two or three things. That try to reduce your body weight. If you are obese, your weight is higher than your routine required body weight according to your height. Your BMI is more than 25, then you have to reduce your body weight. Try to reduce almost 7.5% from baseline of your baseline body weight. So suppose you are 100 kg body weight, and if you reduce your body weight by 7.5 or 10 kilogram, then definitely you can get benefit in reduction of almost 10 millimeter of mercury of systolic blood pressure from baseline. So one most important thing is weight loss. Another thing is diet advice. Diet advice in hypertensive patient, that is DASH diet. That is diet advised in systolic hypertension, which includes restriction of salt. Restrictions of salt is almost 4 to 5 gram of salt per day, which is something about 1 teaspoonful per day. That is, if your salt intake should not be more than 1 teaspoonful per day. That starts from 8 a.m. morning to next day 8 a.m. in the morning. Another thing, that take plentiful of fruits in your diet. That is about diet, low salt intake and high fruit intake. Third thing, you have to consider, apart from weight loss and this diet, do regular exercise. Do regular almost 30 to 45 minutes a day routine walking, that is modest walking, that is almost 30 to 45 minutes a day, at least 5 days a week. Try to walk at a modest speed that helps to maintain your heart healthy, that helps your respiration healthy, and that also helps to keep your this stress level is also downward side, and that makes that also helps to reduce your blood pressure. So these are certain advices that you can follow in your day-to-day life, that includes diet, exercise, weight loss, and stress reduction. For stress reduction, you can also do yoga and meditation and so these are all remedies which you can utilize for your hypertension. Another thing I would like to tell you now for hypertension, that is ABPM. ABPM, what is ABPM? That is ambulatory blood pressure monitoring. What is ambulatory blood pressure monitoring? Ambulatory blood pressure monitoring is just blood pressure monitoring of your 24-hour period. Suppose you have seen a lot of patients, or if you have heard about many of your colleagues or many of your neighbors or friends, that yeah, my blood pressure only happens when I go to doctor. I'm so much anxious so that my blood pressure goes up. In that cases, we never know that what blood pressure what is going to happen in your body after going outside of your doctor's cabin. So in such type of cases, or in such borderline cases, those who have pre-hypertension, I just mentioned previously before few minutes, that your blood pressure systolic between 120 to 140 and diastolic between 85 to 90. In that case, if you are hypertensive or not, we can have some idea from this ambulatory blood pressure monitoring. That is, this ABPM it is also available useful clinical tool which you can ask your doctor for your ambulatory blood pressure monitoring, and from in that ambulatory ABPM analysis that measures your 24-hour blood pressure record, that records your blood pressure at interval of every 20 minutes, and doctors can analyze from their your that almost more than 45 or 50 blood pressure recording per day, and from that we can consider certain data that you are hypertensive or you are not hypertensive. That is something regarding white coat hypertension. White coat hypertension is blood pressure, high blood pressure in doctor's cabin, but normal blood pressure outside the cabin. That is white coat hypertension, and that in that cases this ABPM instrument works very well, and we can even find out some masked cases of hypertension as well. Sometimes many patients complains to us, sir, my blood pressure right now, I'm so much excited, or today my work level and today my stress level is so much high, so my blood pressure is somewhat high today, somewhat 145 or 16 149 or 148, and diastolic 90. So sir, I'm not hypertensive. If you want to check it again. I'm not hypertensive. But in such type of cases, this ABPM instrument also helps a lot, and in that cases we can find out masked cases of hypertension, and we can treat this hypertension. And the reason only for this treating hypertension, to prevent long term complications of hypertension, long term prevention of stroke, prevention of cardiac related complications, long term prevention of diastolic failure of heart, and long term prevention of chronic kidney disease. So friends, this is something superficial about hypertension, and I would like to conclude my talk right now that diagnose your blood pressure in a right time, treat it initially when you diagnose. Don't afraid or don't deny to start your antihypertensive treatment, and try to keep your blood pressure systolic of 120 and diastolic of 80. Maintain your healthy diet, maintain your stress level, try to lose your weight, keep yourself active, and monitor your blood pressure regularly, as well as other parameters like sugar, cholesterol, and blood sugar profile. Maintain all these things, and this is everything about hypertension from my side. Try to keep yourself healthy. So friends, thank you for your kind listening. Bye. And